Welcome to The Explainer. Today, we're diving into something that is literally a game changer for women's health. We're going to unpack the results of the HIFU R1 study. It's this fascinating French multi-center trial that explores a completely new, high-tech way to treat rectal endometriosis. And they're doing it using high-intensity focused ultrasound, or HIFU for short. So, just imagine for a second. What if we could treat the agonizing pain of rectal endometriosis without having to resort to a surgical sledgehammer? I mean, this is a massive question for the medical community because deep infiltrating rectal endometriosis affects 8 to 12% of women who already suffer from intestinal endometriosis. It's a condition that causes absolutely debilitating pain and severe digestive issues. It completely disrupts daily life. For the longest time, the options have been heavily invasive, but as we'll see, that paradigm might really be shifting. Okay, let's dive into this. Here is our roadmap for today. First, we'll look at the endometriosis dilemma. Then, we'll enter the world of HIFU technology. Third, we'll talk about the 30% power-up. Fourth, safety first. And finally, we'll look at the life-changing results. Section 1. The endometriosis dilemma. The burden of disease.
You know, rectal endometriosis often extends from the uterine ligaments and merges into this large, fibrotic lesion sitting right between the rectal and uterine area. And the symptoms? They're agonizing. We're talking about severe dysmenorrhea, which is just extreme period pain, deep dyspareunia, meaning severe pain during sex, and debilitating gastrointestinal issues. Patients suffer through this relentless cycle of bloating, painful bowel movements, and alternating between diarrhea and constipation. It's a massive physical and mental burden to carry around every single day.
Traditionally, the standard of care to fix this has been surgical resection. But let's be real, that approach is highly invasive. I mean, surgery usually means spending about a week in the hospital, and it carries acute adverse events in 10% of cases. There's even up to a 29% risk of post-operative voiding dysfunction, which basically means long-term trouble emptying your bladder. So this study asks a really important question. Can we replace that surgical sledgehammer with a precision laser? And that is the exact promise of high-intensity focused ultrasound.
Moving on to Section 2, enter HIFU technology and how it targets the nodule. And this brilliantly illustrates the device in action. It's called the Focal One, and it's an ultrasound-guided robot inserted transrectally. The clinician basically just manually traces the contour of the endometriosis lesion on a screen, and then the software takes over. It automatically fires focused ultrasound beams to literally heat up and destroy the nodule. But here's the kicker. Notice the precision. The system enforces a strict 3mm safety margin from the rectal mucosa. That margin is absolutely crucial to prevent dangerous complications like rectovaginal fistula, making sure healthy tissue stays totally untouched while the disease itself gets targeted. Now here is a number that is definitely going to make you pause. 32. The median duration for this targeted robotic procedure, from putting the probe in to taking it out, was a mere 32 minutes. When you compare that to traditional surgeries for deep infiltrating endometriosis, which can easily take over 3 hours and sometimes require extensive bowel resection, wow, the contrast in operating time is absolutely staggering. Section 3, the 30% power-up, turning up the heat. So before this specific trial, the researchers actually ran a smaller feasibility study on about 20 patients. And while that earlier study was a success in making patients feel better, the follow-up MRIs showed it didn't actually physically shrink the endometriosis lesion. The doctors knew they needed a demonstrable physical effect on that nodule to ensure long-term relief and truly prove this concept works. So they decided to try something bolder. Their solution? Turn up the heat. For this new study of 60 patients, they cranked up the intensity of the HIFU beam by exactly 30%. And this sets up the central, really critical question of the trial. Would this extra 30% power actually shrink the nodule physically? And more importantly, could they do it safely without causing severe thermal damage to the surrounding organs?
Section 4. Safety first. 0 severe complications.
If you're not familiar, the Clavien-Dindo classification is just the standard system surgeons use to grade complications. In this trial, 56.7% of patients had grade 1 events. These are minor issues that just spontaneously clear up without any intervention. Another 3.3% had grade 2 events like an infection or voiding dysfunction. But look at the bottom row. This is the massive tension release the researchers were hoping for. Grade 3 or higher complications were at absolutely 0%. Even with a 30% power increase, there were no severe complications and 0 rectovaginal fistulae. That 3 mm safety margin held up beautifully. So the crucial point here is that this pristine safety profile translates directly into rapid recovery for the patient. Get this, 91.7% of patients in this study literally went home on day 1. Plus, for 30% of the patients, they didn't even need general anesthesia. They just used a spinal block. And by day 8, the median postoperative pain score dropped entirely to 0. They effectively took a major high-risk surgical ordeal and turned it into a safe, virtually outpatient procedure with practically no recovery time. Section 5. Life-changing results looking at efficacy at 6 months. Now, what's really interesting about this slide is you get irrefutable visual proof that the 30% power boost did exactly what it was meant to do. On the left, in panel A, you see the MRI showing that dense endometriosis nodule before treatment. In the middle, at day 1, you can clearly see the swelling, the edema, from the ultrasound energy working its magic. And on the right, panel C, 6 months later, that nodule is practically invisible. Through blinded MRI reviews, the study showed a highly significant 28% average decrease in the total volume of the nodules. Let's connect that physical shrinkage to the actual human experience. These radar charts are amazing. The red line is the patient's baseline before the procedure, and the green line is where they were at 6 months out. On the top chart, the shape shrinks dramatically inward, which means a massive, statistically significant drop in acute pelvic pain, painful defecation, and diarrhea. At the same exact time, on the bottom chart, which tracks health and well-being, we see dramatic leaps outward. Physical functioning, social functioning, mental well-being, it's all up. We're looking at significant, sustained improvements across virtually all gynecological and digestive symptoms. When you combine the physical reduction of the disease with a drastic drop in pain and this huge boost in daily functioning, you get this remarkable metric. 96.6% of patients in the study said they would recommend this treatment to a friend. 94.8% said they would gladly undergo the retreatment if they had to. I mean, that is a powerful real-world testament to the human impact of this non-invasive approach. It's not just about getting good clinical data on an MRI. It's about successfully giving these patients their daily lives back. Which leaves us with the final, really provocative thought. What does this all mean for the future of conservative, non-invasive treatments in women's health? As this technology continues to get refined, and there's actually a double-blind randomized study already underway, we're looking at a very real possibility that precision HIFU technology could soon replace the surgical sledgehammer as the primary first-line defense for deep infiltrating rectal endometriosis. Thank you so much for joining me to explore this incredible medical advancement. Keep learning, stay curious, and I'll catch you on the next explainer.